consumer education for the Illinois health insurance marketplace. It is my job to make sure that everybody in the entire state of Illinois understands what the health insurance marketplace is and what it means for them and their family. I was at a faith event earlier this summer where I announced what my role was in this entire program, and I heard someone in the back say, "We're praying for you." And so I said, well, thank you. We know that there is a lot of work to do. So tonight I'm just going to give generally a high-level, broad scope of what the ACA is, what Get Covered Illinois is, what it means at a tactical level for you, your family, and your small business. One of the points that was just brought up, it's very important to bear that Illinois is fortunate to have passed the legislature and signed by Governor Quinn Medicaid expansion. The idea that now childless adults and people who are extending in that poverty line are now included. The reality was that people think of Medicaid as only being for poor people, but the truth is it's actually much more narrow than that. You need to be below a certain income threshold, but you obviously need to be pregnant or you needed to have children. But now if you're a childless adult and you're meeting a certain economic threshold, you are now covered. So we believe just with this simple passage of legislation this past spring, about 342,000 people will now have access to quality, affordable health care. And that is a really, really, really important dynamic and ultimately the Affordable Care Act's goals of bending the cost curve for those that have it and providing access and affordability for those that don't. So let's walk through the PowerPoint slide. I want to make sure that I have enough time to answer all of your questions. And of course, the highlight of the evening is partnering with our amazing organizations here to help you individually walk through your problems. So what is Get Covered Illinois? Get Covered Illinois is the official health insurance marketplace for our state and offers a way for you to shop for and compare qualified health care plans against all the other plans in Illinois. So it's important that we lay this out. This is the place, it is a website where you'll be able to go online once the federal website is up and running, and we can talk about that in a second. And you'll be able to see all the carriers who have submitted plans to the Department of Insurance. Our actuaries and our department regulators reviewed these for a number of different criteria to make sure that they met the 10 essential health benefits. And then because we are a partnership state, we're not running our own state-based marketplace, we made recommendations to the federal government, and they're posted on there. And then what you'll do is you'll go online, you'll type in some basic demographic information, whether you're a tobacco user or not, your household income, your household size. Those are the only questions that we'll be asking you now. Before, we would ask about your medical history, your pre-existing conditions. Those things are a thing of the past. At no point can an insurance company ever ask you what your medical history is. So this is the idea, is that regardless of where you've been or what conditions you've been through in the past, all they want to know to determine your rates is where you live, how many people in your household, what's your household income, and whether you're a tobacco user. That's it. That's the list. So why Get Covered? Having health insurance, being there for your family when they need you. One of the things that we kind of, when we looked at what it took to actually get to enrollment, obviously when I started here in January, the first thing I did was try to get a sense of who our target demographic was, who are the people that we needed to enroll in order to make this successful on the private side. And what we found was that nearly 4 out of 5 people that we needed to enroll in the marketplace or in Medicaid expansion had no idea that we were coming down the road. They had no idea this was coming for them. And it wasn't like they were confused about the nuances of the essential health benefits, or they were concerned about the efficiency of the single stream application. They didn't know that this was coming. So we knew that we needed to find a way to reach out to as many people as possible and to connect them with what getting covered means. So our first guiding principle, we said, how are we going to go about doing this? We talked about creating a statewide culture of coverage. You'll never hear us talk about marketplace, you'll never hear us talk about Medicaid or Medicaid expansion. We talk about coverage and what that means for everybody throughout the state, whether it's an individual, or your family, or your small business. If we are disciplined and focused on making sure that everybody understands what coverage means, then people will come. They'll know what coverage means for them. And so for some families, that may be a conversation about economic stability, the idea that you'll never, ever, ever go bankrupt for getting sick again. And for some individuals and some families, that may be a conversation about wellness and health. Now, you don't have to wait to go down to county hospital when you get sick. You can go see a doctor and get free checkups and preventive care. That is all included, whether you're on the public insurance side or the private insurance side. So this notion of coverage was something that we are going to be driving every single day through our paid and earned media opportunities, but also through the partners that were mentioned here earlier. So, as I mentioned before, you can no longer be denied coverage because you are sick or you have a condition like asthma, diabetes, or even cancer. And all the plans that you'll find through the marketplace cover important things like doctor visits, hospital stays, preventive care, ambulatory, the mental health and substance abuse. All of these core elements are baked into everything that we sell in the marketplace. So there may be some people who say, well, you know, I used to, if you look at some of the plans that I used to get online, this is significantly more expensive than what we had last year. Don't believe it. You have to look at what the details. The plans that the Illinois Health Insurance Marketplace, Get Covered Illinois, is selling are quality, top-notch plans. We believe that all the things that are required to be part of this will create a system of wellness, preventive care, and for those of us who currently are blessed with quality health insurance, we'll see our premiums decrease over time as consumers start engaging in the healthcare delivery system, which is healthy, for lack of a better term. Going to see the doctor before they get sick, going to get preventive care as it happens, you know, knowing that they don't have to wait until they actually have a heart attack before they see somebody. So these are all things that we are all connected, and all of those elements are here in this plan. Yes?
So you said decrease over time.
Mm-hmm.
Are we talking 5 years decrease, or at this point?
Sure. So I think that the question was that, you know, I mentioned about the stability element here. What we've seen over the last 20 years, but more specifically over the last 10 years, if you look at the graph of what health insurance costs for a consumer, in small businesses, it is escalating at a certain point. So the idea of making sure that everybody has access to coverage will stabilize that. The insurance companies are, if we're going to make the insurance companies actually cover just the sick, and we need to make sure that there's young and healthy people and middle-aged people and everybody across the board to get that coverage. But as long as people are going to see doctors before they get sick, that's a much, much, much less expensive way to treat everybody. So those costs will actually will reduce over time. One of the biggest lies is that, you know, all of a sudden we're giving out free health care to everybody, and why should I pay out of my pocket? Well, the reality is everybody here is paying for that insurance now. The idea if someone goes to the hospital and gets treated at the point of a heart attack, those costs are distributed across everybody as well. So if we can somehow manage to create a system where people are taking care of themselves and wellness becomes the goal, not just treating a sickness, then that will have a tangible effect across healthcare costs for everybody. So the answer to your question is, you'll see it right away. In fact, you're seeing it already. Some of the core implementations of the ACA, even before the exchanges and the Medicaid expansion went into effect, has seen a reduction in healthcare costs because of the things like the 80-20% insurance costs, where insurance companies can no longer spend less than 80% of all premium dollars on things other than treating patients. So that means insurance bonuses, advertising, administrative costs. So it's requiring insurance companies to be more laser focused on how they spend their dollars. So everybody participating in healthcare the same way will see, one, improved healthcare outcomes, but most importantly, a stabilizing of price, in some cases lowered, and seeing that continue.
But I think the biggest determination of that is top down. The medical practitioner has really got to be involved in prevention as opposed to treating symptoms.
Sure, and then I think that we're seeing that in a lot of like the managed care programs that are taking place. The idea that it's not about just being paid for service, it's about measuring health outcomes and compensating folks that way. It's also kind of incentivizing this market model that people seem to appreciate and love, unless it actually is to do with the Affordable Care Act. So I'm enormously confident if we get to a point where everybody is covered, we'll start to see these positive outcomes develop. So this is a very small printed fonted slide, so I won't go through there, but this is about costs and how costs are measured. There's a lot of interest across the state on the insurance carriers and the plans and the levels, et cetera. But the reality is that if you add in the number of rating areas, there are 13 rating areas across the state, the number of plans and levels within those plans, there are literally thousands of combinations of insurance plans that residents of Illinois can choose from. However, when you include premium tax credits and cost-sharing subsidies, the idea that makes this affordable, and depending upon your income, we literally will have hundreds of thousands of potential combinations. So for me to tell you that this plan costs this and this plan costs that, it's only telling you a small portion of the story. I'll give you an arbitrary example. So let's just say I wanted to go to the ABC insurance company. I have a pre-existing condition. I've never been able to afford it. I live in Chicago. I shop for a plan. I see my doctor. I see this network. It's going to cost me $100. Well, $100 is a significant amount of money for me and my family. It's really more than I can afford. And by the way, this is an arbitrary example just to kind of create some sort of understanding of what it means. But that $100 monthly premium only tells a small portion of it. If you are a family of four making $94,400 a year, you will be eligible for premium tax credits. That is 400% of federal poverty. You are eligible for a premium tax credit, which is essentially an upfront payment of taxes to offset the cost of your premiums each month. That's a sliding scale. So if your family of four making slightly less than that, the amount of your premium tax credit obviously gets greater, and the lower you are in that scale, not only will there be tax credits for the cost of the premiums, but there'll also be cost-sharing reductions for like things like deductibles, out-of-pocket costs, copay. So the plans that they are as they are listed on the sticker are not the whole story. The whole story is, what are you and your family eligible for tax credit? So take that in mind. You know, I always say that this is a marathon and not a sprint. The people that are going to be shopping for these plans are not going to be the kind of folks that walk right onto a car lot and see the first car and they'll drive it away and they're happy. They're going to go to Consumer Reports. They're going to test drive a whole bunch of cars. Maybe they'll go to Carfax or CarMax and then see if they can find a used car. We believe that insurance plans are going to be the same exact way. You're smart, you're savvy consumers. You're going to pick the plan that meets your family's needs, that fits your pocketbook, and also importantly, find out where your doctor is, where your network is, where your hospital is. All these are things to consider as you're selecting your plan. Yes, sir?
You mentioned about what the subsidy would be for income of family of four. What if you're single?
I think if you're single, I think $45,000 is that 400% of federal poverty. So there's premium tax credits for you as well. I know there's a chart that's going through my brain, but if you're single, if you're childless, if you have 2 kids, 3 kids, up to 8 children, the idea is that there are literally hundreds of thousands of combinations that you can actually choose to get that premium tax credit. And I don't want to assign a certain dollar value for either of these because it varies upon where you live, your household size, et cetera, et cetera. Yes?
Are assets considered or merely income?
Sorry, your question was again?
Are assets considered or
so essentially that is a tax portion. So it's your household income. So whatever you would place on your income tax as your income for that year. It may be 0, it may be $1 million, somewhere in between. However you would declare your household income on your taxes from 2012, that would be essentially the baseline for making your determination. What happens is you submit your amount, what your income is, and then it's pinged to the IRS to say that yes, this is exactly what the income is. Now, people may actually increase their salary during the course of the year, so they may make more money. Fortunately, hopefully, that all of us will do well over the course of the next year economically. And if that's the case, then there's a reconciliation process. So it's all based upon what your declared tax household income is.
Personal assets are totally out of legal.
I don't want to get into like whatever the IRS, I think it's line 37, whatever that you put on there, however you come to the determination. Okay. All right. So I saw a question. So let's.
Did they actually? Because I know a lot about this discussion. I am an expert. Did they actually go on and define modified API at some point and decide what year they're actually doing reconciliation on and all that stuff?
I'm
the question was, yeah, I guess, the question was the modified gross income, MAGI, the term. So essentially, they will be reconciling the previous year. So we're going into the plans that we're talking about right now are the plans for year 2014. 2013 will essentially determine kind of where your upfront is, but the reconciliation on where you fit will take place when you file your 2014 taxes, probably in January, February, April, March of 2015. So essentially, you're going backwards. Now, look, this works both ways. If you're fortunate enough to see your income, then of course that tax credit will be reconciled on your returns. But if you've seen a loss in salary, then that loss will be reconciled in your favor. That's how the system is going to be set up. I'm sorry? How is? Sure. So it actually goes through. That's a great question. You actually submit payments through the marketplace. The money goes directly through the marketplace. Your premium tax credits are included, and then they're directed right to the carriers themselves. So it's
And then they send you a bill.
and then you get either a bill for services that you use. You get your card from them. What we're selling here essentially is private health insurance plans. These are not, the public option is not available. There is not a government plan in here. There are a number of 6 carriers who have been certified by the Department of Insurance to sell plans. The only difference is the marketplace acts as an opportunity for you to shop for and compare all the plans against each other on a level playing field, and depending upon your eligibility, determine what your premium tax credit or your cost sharing reductions might be. Yes? Your last, right, so essentially you put in your household income, right, and you say it's $10,000. When you determine your subsidy, there's actually the federal data hub. It will ping the IRS and determine whether or not that is actually makes sense, and then based upon what that information is, will provide your subsidy. But obviously, people's incomes are fluid throughout the year, so when you file your 2014 taxes, it will make a determination as whether that needs to be reconciled or not. So if you receive more of a premium tax credit than you were eligible for, then the value of those tax credits will be added onto your tax bill. If it determines that you actually were entitled to a much larger premium tax credit subsidy, that will be added to your tax bill at that particular point as well. You would get a refund, exactly.
So they're actually going back to 12 now because it's all the tax left?
Preliminary.
Sure. So what you would do is you would enter, I made $10,000 in the eligibility period, what your household size, and essentially all of this information is connected, and it'll be pinged to Homeland Security, it will ping to IRS, to make sure that it verifies exactly who you are, who you say you are, and whether you're eligible for all of these things as well. And so it kind of gives you that baseline idea of what your reductions would be. But throughout the course of the year, you may see changes. So that's what the next year's tax return will determine what those cost sharing reductions are.
But you have to pay out of pocket the whole amount in the meantime.
You have to pay, right, so you're getting credits towards the premium. The premiums are the premiums. What you're getting is assistance from the federal government. So yes, you're still responsible for your share, but if it determines that you're entitled to more, then you will get more and not less. It's one of those, I know that a lot of people have been kind of doing these presentations all over the state for the better part of the last 7 months, and it's this idea of, you hear hoofs behind you, is it a zebra or is it a horse? Is it a zebra or is it a horse? The reality is that 99 times out of 100, the hoofs you hear are going to be a horse. So we could probably try to find all of these unusual occurrences and dynamics that may be at play here, but the reality is, once people can actually access the federal hub, when they can get past the security screening questions, that part is working. So the understanding what you're eligible for and what you're paying for are going to be clear to you as well. Yes?
Hi, what are some of the main problems that are hindrance to consumers currently, whether it's federal or whatever? What are some of the cracks in the system that
Sure.
we'll need to be patient with?
So I am nothing but a half full kind of person. So I'm going to talk to you about what's working particularly well. The Illinois website getcoveredillinois.gov was up on October 1 and is performed beautifully. Anybody can find all information about what the marketplace is and how it affects them and their small families. There is a screener tool for people that actually want to purchase insurance and see kind of where they fit into the scale. So they'll be sent either to the Medicaid side or to the marketplace side. That tool is working particularly well. If you're looking for assistance, you can enter your zip code in your county and you can be networked with some of our granted partners who are here today who can either walk you through this problem so you can find assistance at a moment's notice. You can identify where events like this are posted online. So whether you live in Cook County or Cairo, Illinois, or Lake County or the Quad Cities, you know that there's going to be assistance for you there. So these are things that we built here in state that we're tremendously proud of. Further, on October 1, the state stood up a help desk, which is a 7-day-a-week call center for people who want to talk to someone about some of the options, how to find help, answer basic questions. Those are available to them. That was up on October 1, and we're seeing a robust volume of calls. So that's what we've been able to control as a state. Has performed very, very well. There's some things that we need to work out, and that's understandable. Anytime you launch a website or a help desk and a program as big as what we're doing with our sisters is bound to have some bumps. Now, on the federal side, the reality is that because we are a partnership, meaning the state does not run its own marketplace. So people, essentially, we didn't get legislative authority from the General Assembly to run our own state-based marketplace. We went to the Fed and we said, look, we really, really want to be a state-based marketplace. We don't have the votes this year, but what can we do in the meanwhile? We had every intention of becoming one. So we are running our own consumer assistance, which is our navigator program throughout the state. We're going to have nearly 1,000 people across the state who are assisting people who have questions and facilitating enrollment. We're doing our outreach education. You're going to be seeing very shortly a massive marketing and earned media campaign. We'll be driving people to this website. And those are things. And so for the first year alone, unfortunately, people are going to the federal facilitated website, healthcare.gov. And what they're seeing right now is essentially a lot of demand and volume and some design concerns on the front end where people are kind of getting bogged down in the beginning when they're trying to answer some security questions and not able to get through. But the back end part, the federal data hub that pings Homeland Security and IRS, that is all working well. So once they figure out how to unclog the front part, the actual car itself is working very well to kind of mix some metaphors right there. But I think there's a lot being communicated about what the glitches are in the federal website. But the reality is that people, we knew that this month was going to be a month of education, and to let people know what Get Covered is, do events like this all across the state. Because the plans for all the October 1 discussion and the launch of the campaign, the plans do not begin until January 1, which means that you have from today till December 15th to sign up and enroll in a plan that meets your family's needs. They don't start until January 1. So we want to take advantage of every single day going forward to educate our consumers, to build connections with the trusted entities that are here. I mean, one of the things that I'm really excited about, and with the partners who are here tonight, is that out of the 44 lead organizations which we granted $27 million, nearly 240 sub-grantees all across the state, a sizable majority of these organizations have never ever been involved in healthcare delivery before, but they were trusted. They're known in their communities for providing services. So we provided them the training and the resources and empowered them to take true ownership of this. So these partnerships that we're developing with the state are something that we're enormously proud of.
So we can just go to Get Covered Illinois and sign up or put in our zip code. We don't really, is it even necessary to do it with the federal side?
Yes, if you want to enroll in a qualified healthcare plan on the marketplace, you're going to have to go to healthcare.gov at some point because we are in a partnership with the federal government.
Thank you.
You mentioned Homeland Security.
Sure.
In what context did you mention that?
So essentially, that the only people who are eligible to purchase plans on the marketplace are those who are legally present. So that would fall under, so to make sure that Brian Gorman, who says that he lives in Chicago, actually is Brian Gorman who lives in Chicago. Yes?
Am I right in thinking that this evening, here in this group, you won't be giving information about Medicaid and sources, what one should do about that? I do have one question. I notice on our yellow sheet here, it says that 138% of the poverty level will qualify for Medicaid.
That is correct.
And I've heard 130 and 133.
Sure. So essentially, you have.
No, that's okay.
Okay.
I know the answer.
Yeah, so essentially the Medicaid goes up to 138 to 133, potentially eligible in certain states as well. There's a gap between 133 in some states, that's where the current Medicaid levels are, and 138 there.
But for Illinois,
Correct,
it's
138.
Yeah.
So, one of the things that we're trying to communicate to our consumers is, look, it's not about Medicaid, it's not about Marketplace, it's about getting coverage and needing that coverage. And so, to answer your first question, yes, there is information available tonight on Medicaid. You can, if you're eligible for Medicaid and you need to enroll, you can make that happen tonight. So these are, all of our assisters across the state are trained to deal with both Marketplace with subsidy, and then Medicaid. And if turns out that you're eligible for other social services like SNAP and TANF, they can start that process for you as well.
Okay, and then there is it under getcovered.gov that one would look for Medicaid information?
So
Or is there
getcoveredillinois.gov is the first place that you'll go. When you want to get covered and take action, you'll enter some basic questions in the screener, and depending upon your economic situation, you'll either be triaged to the AID system, which is the state Medicaid page, Access for Benefits Eligibility, Abe Lincoln Creative,
Okay.
or to the FFM, and that's where you start getting to very specific questions about the Medicaid.
Very good. Thanks very much.
You're welcome. You're welcome. Yes.
One more question on the community service. If I expect my income next year to be a lot lower than it was in 2012, and I put down what I expect it to be, and the IRS sees that, is this going to follow up my income? Do I have to put down what I thought what it was in 2012?
It depends. I'm not exactly 100% sure on what the formula is on the back end. I think the best thing is to kind of put in what your income, what you think it might be. If it's way off base, then they'll probably come back to you, and it all happens instantaneously. But I hope that you make a lot more money next year than this year. That would be good news for all of us. Any more time?
Is there a last question or two? So I want to be able to get you all to these folks. So how about we take these two more questions, and then we'll let everyone get out and talk to counselors.
Sure. Looking at people in the same household, do they need to be legally joined? Partnered or married or?
So how households are defined vary by state to state. Obviously, household is, I'm not 100% positive how to answer the question of how civil unions play into this, but a household is a household. That's a tax question that I'm not 100% familiar with. I can follow up with that. But one of the major concerns, I think, as opposed to how a household is defined, is the number of families, especially here in Chicago and across the state, have mixed status families. The idea that maybe the father is undocumented, but the mother and the children are documented, or the parents are, but the children aren't. It's important for people to know that that there is no action that the Homeland Security will take on any of those individuals who are determined to be ineligible for Marketplace coverage. In fact, quite the opposite is true. What we'll find out is that, okay, you, sir, head of household, are eligible for Marketplace with subsidies, but that your spouse is ineligible, but she may be eligible for these services, and your children may be eligible for all kids. So really, the challenge for us is one, trust. People know that this is not some sort of gotcha program where people are being less than forthcoming and not getting the services that they're eligible for because they're afraid that somehow someone from the immigration is going to come down and swoop and make challenges. None of that is going to be happening. But two, to make sure that people know that there are health options available for them, and that's important.
I guess specifically, are partners have to be married or legally recognized for that to be considered a household?
I don't know the answer to that question.
Because it's a federal.
Correct. So, right. Yeah, I mean, it has thrown, I mean, the federal, I'll say this, the federal government is recognizing all same-sex marriages in states that it has allowed. So essentially, it's really, it is a watershed moment that really most people know
We
about.
need to pass marriage.
Yes, we do.
Yeah.
That would certainly make these questions a lot easier to answer if that would determine. But because it's a federal program, if you are married, if your state determines that you are married, then you are eligible for those benefits. Okay. And there was one more question.
I had more specific questions because I went on like a cover of the federal website.
I'll repeat the question for everybody who can't hear what you said.
And can you actually look at plans without giving all this information? Or do you have to give all this information to read the plan?
Very astute observation. So that is a lot of the problems we think technologically. So the question is, do we have to give all this information to actually shop for a plan? And the answer is right now, yes. And that is a lot of the problems that we're seeing. States that have set up their own state-based marketplaces have identified this as a potential clog and have allowed for anonymous shopping. You don't get the full picture, but at least you're able to kind of get a sense of what networks are in what areas, and then once you're saying, okay, this is what I think I want, then you can take that next step of registering and giving your household size and going that way. But unfortunately, as of this moment, there is no anonymous shopping allowed. I know that there have been some functionality that they've kind of thrown out, but what you're talking about, what we all hope to be, certainly doesn't exist right now.
But it may change.
Hopefully. Hopefully, if that is indeed the problem. So look, I'm grateful. This is a really fantastic turnout. I know that there are a lot of questions and concerns. Yeah, absolutely. But for those of you who want to talk to a navigator, they are fantastically trained. We're extremely proud of them, and they can help you through it. And if they can't help you tonight, make sure you give them your name, your email address, and contact information, and you can set up an appointment so when the federal website does come up and working and you're ready to make a decision, they can help facilitate this. So thanks very much, everybody. Good night. I'll be over here to answer some questions if we have.
All right, Brian was great. Okay, thank you very much. Really very fabulous information. So we have, I think, 10 or 12 at least, probably even more than that, in-person counselors here. So, and we have phone. Everyone has a number. So hopefully no one's going to have to wait too long to get your question answered. Really appreciate your attention, your interest, and any feedback is welcome, and we'll try to get back to you. Any other information or set up other events too if that would be useful for you. So let us know. This is Kathy. I want Smith from my office who really helped set this all up. So thank you very much, Kathy. Give her any information about what else we could be doing to make life easier for you guys. Thanks.
So anyone who has like 1 through 5, if you want to go to the table over there. And then we'll have 6 and 7. Come on over.
Well, they gave me a chit with number 4, so she said 1 through 5 or 6 over there. Well, I can oh boy, because I'm 72. Yes. I see, so what is it?